In their recent public statements and last debate performance, Kamala Harris and Donald Trump presented really different healthcare platforms, which reflect their broader political philosophies and what they see as the most important healthcare issues for a large portion of the American population. Let's see if we can make sense of it all. I'm Dr. G. I'm an internal medicine physician in Hollywood, Florida. I'm a lifestyle modification coach and a patient educator. Aren't you excited? It is election year. Nonstop ads and bickering in chat groups with friends, making broad opinions. Joy. You're not going to see a plateau dance right here. Anyway, it is almost time for Americans to make a choice at the ballot box as to who their preferred candidate is, or at least the candidate they could somewhat live with for the next 4 years. So whether I like politics personally or not, as a medical professional, it is my responsibility to pay attention to this aspect of the political process, because public health policy is driven so much by what happens in Washington, D.C., as well as in our local governments. So let's do our homework and take an unbiased look at each of the candidates and what they've been saying and what they want to do if they win the presidency based on their most recent public statements. So let's take a look at Kamala Harris's healthcare platform. Harris appears to advocate for expanding access to affordable healthcare by aligning with many of the policies championed by the Biden administration and the Obama administration before that. Her focus has been on protecting the Affordable Care Act, or the ACA, and emphasizing the need to reduce prescription drug costs, improving access to preventative care, and extend Medicaid coverage. Harris also supported measures to expand Medicare access, though she has distanced herself from the more radical Medicare for All proposals, instead opting for a more gradual approach to expanding coverage. Harris's healthcare platform also focuses on addressing healthcare inequities, particularly for marginalized communities. She has proposed strengthening mental health services, which is sorely needed, maternal health care for women of color, of course, and expanding protections for reproductive rights, including expanding pro-choice options, which is a very touchy subject right about now. Her plan is structured around increasing government intervention to ensure universal access with an emphasis on public health as a collective responsibility. That's what she says. So let's take a look at Donald Trump's healthcare platform in a broad sense. In contrast, Trump has reiterated his intent to dismantle the ACA, which he criticizes as financially unstable, or unsustainable, I should say. He emphasizes a market-driven approach to healthcare, arguing that competition capitalism will lower costs and improve quality. Trump supports expanding health savings accounts, or HSAs, which allow individuals to save money tax-free for medical expenses, and advocates for increased transparency in healthcare pricing to encourage competition among providers. Trump has also called for something called block granting Medicaid to the states, which would give them more flexibility, the states themselves, in managing their programs, though critics argue that this could lead to reduced coverage. He has consistently opposed government-run healthcare systems, framing them as overly bureaucratic and inefficient. His platform basically centers on reducing federal control, cutting regulations, promoting private sector solutions. So how does this all affect middle-class Americans? For the average middle-class American, Harris's plan appears to promise broader access to affordable healthcare with more government involvement, which could be appealing to those who struggle with rising healthcare costs, but also increase inefficiencies and paperwork bureaucracy. However, it may also raise concerns about potential tax increases. On the other hand, Trump's approach focuses on increasing individual choice and reducing costs through competition, which might appeal to those wary of government intervention, but also could result in less comprehensive coverage for those relying on the current ACA or Medicaid. Based off of all of this, if Kamala Harris or Donald Trump wins the 2024 presidential election, the American healthcare system would likely evolve in vastly different directions over the next 4 to 5 years based on their stated platforms. So under Kamala Harris's presidency, efforts look to be towards expanding coverage, generally. Harris's administration would likely continue efforts to expanding healthcare access, building on the Affordable Care Act, or the ACA, and the middle class could possibly see broader coverage options. potentially including expanded access to Medicaid or even Medicare for some groups. For those currently uninsured or underinsured, there could be more affordable coverage options, particularly for preventative care and prescription drugs. The question is, where does the funding come from for this expansion? Harris also has called for lowering prescription drug costs. Harris has called for government negotiation of drug prices. This is something which has been proposed many times before, but it's been unable to get done legislatively for a bunch of reasons that it's too long to talk about right here on this video. This measure is supposed to be aimed at middle-class families who could benefit from reduced out-of-pocket costs for medications. And this would particularly be helpful for chronic conditions requiring expensive treatments like some of our favorite medications for obesity. Increased public health investment is another part of Harris's administration platform, and her administration would likely focus on addressing healthcare disparities with targeted investments in underserved communities. For middle-class families, this might translate to improved healthcare infrastructure and access to better services in areas like mental health, like I said before, and the maternal coverage and maternal care, which is, again, very, very important. To get all of this, it's gonna mean higher taxes. To fund these expansions, higher taxes on higher income households may increase. And depending on the scope of healthcare reforms, in my opinion, the middle class taxes could also see some upward pressure in order to achieve the kinds of bold expansions she is proposing. But under Donald Trump's presidency, if he were to win, we would see grossly less federal involvement if he gets his way. Trump would likely continue his push to reduce federal involvement in healthcare. And this could lead to the repeal or weakening of the Affordable Care Act, in turn reducing coverage for some Americans, according to some public health experts. For middle-class individuals who rely on the ACA subsidies, this might mean higher premiums or reduced access to care overall. Trump is proposing broad healthcare market reforms as well. Trump's approach centers around reducing regulations and promoting competition. And if he's successful, this could lower some costs, especially in areas like insurance premiums and hospital services. However, critics argue that without safeguards, this market-driven model could leave some middle-class families with less comprehensive insurance coverage. Trump has long been a proponent of Medicaid reform. With the last presidency, we saw some of this, and Trump has proposed block granting, like I said before, Medicaid to the states, which then could result in less federal funding for this program. If states respond by tightening eligibility requirements or reducing benefits, middle-class families with lower incomes or those in need of Medicaid support for long-term care might face greater challenges accessing care. Trump would also like to expand the use of the health savings accounts, like I mentioned before, HSAs. And middle-class Americans might benefit from expanded tax advantages under Trump's healthcare proposals, allowing them to save more from medical expenses through HSAs. But this is making a big assumption. This assumes that they have the actual disposable income to do so, which may or may not be the case for many middle-class Americans. So what is the overall outlook? What does all this look like? Who knows, man? We're just looking at these platforms, but we can kind of, objectively take a look at what it may possibly look like if either of these platforms win. So under Harris, the healthcare system would likely become more government regulated with a stated goal of expanding access and affordability at the forefront. This could possibly benefit middle-class Americans with more comprehensive coverage, but potentially lead to increased taxes for just about everybody. While under Trump, the system would emphasize market competition, potentially lowering costs, but likely reducing access for those reliant on government subsidies or Medicaid. And the middle class might see lower costs for some services, but could more likely face more potential personal responsibility for managing their healthcare expenses. So as far as I can tell from a public health perspective, there are at least 4 key differences to pay attention to. And that's number 1, government role. Harris supports an expanded federal role in healthcare, while Trump favors a more deregulated and private sector-led solution. Number 2 is Medicaid and Medicare differences. Harris is seeking to expand both Medicaid and Medicare, focusing on vulnerable population, while Trump, on the other hand, has proposed changes to Medicaid that could reduce coverage for some with a focus on cost control and state autonomy. Number 3, prescription drug costs. Both candidates actually agree on the need to lower drug prices, but Harris, she's promoting more of a direct government intervention, while Trump advocates for increasing market competition as the solution to do this. And number 4, healthcare coverage. Harris prioritized expanding coverage to more Americans, aiming for a system closer to universal healthcare, but not exactly universal healthcare. Trump's platform is focusing on reducing costs through competition and giving individuals more control over their healthcare choices, but has been criticized for potentially reducing access for low-income individuals, which obviously could be problematic as well. So in summary, Harris's approach leans toward expanded coverage and government oversight, while Trump's plan is focused on deregulation and personal choice. The great impact on middle-class Americans would largely depend on their individual healthcare needs, I guess, and their income levels. And that's what I could get so far from the immensely important part of this year's election. I'm sure things can and will change as the election day gets closer. And as a physician, I think it's extremely important to be informed about the potential impact of elections, federal and local, as they impact healthcare policies almost every single time. I encourage each and every one of us to stay informed and to vote whatever your best interest may be. That's about all I have right now. Like I said, things can and will change, but that's it. See you soon.